Good day, dear friends. With you, Natalia, on the Doctor Online channel, on which I share personal experience and answer your questions. Today we will talk with you about vitamin B12. The relevance of this topic is related, first of all, to the fact that almost every second Russian faces a deficiency of it. So why do we all need vitamin B12? Cyanocobalamin is another name for this vitamin, which is primarily necessary for the normal functioning of the nervous system, for creating optimal conditions for the production of erythrocytes and leukocytes, to reduce the level of bad cholesterol, which is the main cause of atherosclerotic plaques. Vitamin B12 actively participates in metabolic processes, reduces the manifestation of diabetic neuropathy, and, first of all, reduces pain, supports the normal functioning of the cardiovascular system, improves food absorption, and prevents the development of malignant tumors. And do you know that vitamin B12 increases the activity of spermatozoa, increasing their concentration, thereby improving reproductive function in men? Without its participation, the absorption of vitamin A and folic acid is significantly reduced. Cyanocobalamin supports our immune system and improves the condition of the skin and hair. And this is far from a complete list of the merits of this vitamin. By the way, cyanocobalamin is synthesized in insignificant amounts by intestinal bacteria, but this is far from enough to ensure important processes taking place in our body. What is the daily norm of vitamin B12? The need for each of us is highly individual and depends on age, lifestyle, and the presence of certain accompanying diseases. For an adult organism, the daily requirement of vitamin B12 on average is about 3 micrograms per day. Who among us needs additional sources of vitamin B12? People who consume alcohol excessively and smokers often face a deficiency of cyanocobalamin. Additional need for vitamin B12 occurs in pregnant and nursing mothers, the elderly, and people with immune deficiencies. Did you know that the absorption of vitamin B12 in our body can be hindered by long-term intake of calcium supplements, high doses of vitamin C, as well as a range of medicinal drugs such as hormones, neuroleptics, certain anti-tuberculosis agents, and drugs for reducing so-called bad cholesterol? I'm referring to its atherogenic fraction. What threat does a deficiency of vitamin B12 pose for each of us? In the worst case, the consequences of its deficiency can be severe anemia and Alzheimer's disease. With a low level of vitamin B12 intake, each of us experiences weakness, lethargy, headaches, a feeling of lack of air. There may be paleness of the skin, depression, and poor memory. How can we feel that our body lacks vitamin B12? Headaches, dizziness, tongue burning, stomatitis, decreased appetite, sleep problems, numbness of the limbs and feet, unreasonable irritability and depression, increased sweating, hair loss and brittle nails, difficulty breathing, and vision impairment may occur. In the body, cyanocobalamin accumulates in the liver. The total reserve in this case ranges from 2 to 5 milligrams. It is absorbed by the kidneys and spleen as well as muscle tissue. If our body does not receive the necessary resource of vitamin B12 for 4 to 5 years, health problems may occur. Conducting an analysis for vitamin B12 is a chance to timely detect and prevent further development of the problem. Checking for cobalamin levels is recommended in the presence of atrophic gastritis and the development of inflammatory diseases of the gastrointestinal tract, anatomical defects of the small intestine. When conducting differential diagnostics, anemia, and for identifying congenital forms of vitamin B12 deficiency. The algorithm for identifying this problem is interesting in itself. In the first stage, a blood test for vitamin B12 content is conducted in laboratory conditions. Then the patient is given an intramuscular injection of cyanocobalamin, and after a certain period of time, this check is repeated. The presence of absorption problems is determined by an insufficient increase in indicators for vitamin B12 content, which most often indicates the presence of various types of gastrointestinal diseases. Most often these are atrophic gastritis, insufficiency of stomach ferments, decreased stomach acidity, and intestinal diseases. For adults, a vitamin B12 deficiency is confirmed by an indicator below 20 micrograms per milliliter. Many are interested in the question, in which products is vitamin B12 contained in large quantities? First of all, these are animal products. The leader in vitamin B12 content is beef liver. A large amount of it is contained in rabbit meat, beef, turkey, various seafood, shrimp, mussels, cod, whale, and mackerel. A small amount of vitamin B12 is contained in dairy products. Do you know that in case of complete blockage of cyanocobalamin intake with food, its reserves in an adult should last up to 6 years and in a child up to a year? Some of my patients ask, what will happen if they regularly and daily consume products rich in vitamin B12 and additionally take supplements with cobalamin? By and large, nothing will happen. Vitamin B12 is water-soluble, so the body excretes its excess independently through urine. However, it has been established that large amounts of this microelement can cause undesirable effects in people suffering from kidney disease and diabetes. Intramuscular administration of the drug may cause rashes, among other things. There is data suggesting that at a daily norm of 3 micrograms, a nearly 2-fold increase in vitamin B12 in an adult's body is safe. However, it is not advisable to abuse this. By the way, our body is designed in such a way that it can only absorb the amount of vitamin it actually needs. So don't worry too much about this. Were you with Dr. Savkina? Subscribe to my channel so you don't miss out on many new interesting and useful videos, and stay healthy.